Good afternoon, everybody. I am Dr. Rajiva Gupta, Senior Consultant in Internal Medicine and a diabetologist at Fortis Hospital, Shalimar Bagh, and my own clinic, Upchar Wellness, at Ashok Vihar Phase 2. Today we will be talking about a very common topic, that is chest pain. So whenever somebody has chest pain or hears of a chest pain, there is a natural panic reaction, and people think that any chest pain has got to do something with the heart, or the patient is going to have a heart attack. In fact, it has been observed that chest pain accounts for a large number of visits to the emergency rooms of hospitals, to the clinics, and also to cardiologists for their opinion. However, various figures say that almost more than 50% patients who are referred to for chest pain do not have a cardiac problem. So therefore, it becomes important for us to identify as to which type of chest pain may be more serious prognostically. Now, before going to that, we should understand the causes of chest pain. So causes of chest pain, just imagine, now person is having a chest, so if we go from outside to inside, so there is the skin, then there is the muscles and subcutaneous tissue, then the bones, then within the rib cage there are organs, the lungs have got their covering the pleura, the pulmonary vessels, the pulmonary arteries and the pulmonary veins, the heart has got a muscle, heart has got the blood supply in the form of arteries, then heart has got a covering, pericardium, and heart has got the inner lining called the endocardium. So each one of them can give rise to pain if any disease is involving these parts of the different parts of the body. Let us talk about, rather than going into the whole list of the entire causes, the most important causes are, so we will talk about the chest pain. Chest pain because of cardiac origin is of two types. One is angina and another is heart attack or myocardial infarction. In angina, there is a temporary occlusion of the arteries of the heart, and the pain is felt in the middle. Sometimes it radiates to the jaws, to the shoulders. It gives rise to sweating sometimes, and it usually comes on when the patient exerts or after a heavy meal. The duration is typically less than 30 minutes, half an hour, occasionally 3 to 4 minutes. The other is myocardial infarction. The pain is more prolonged, the patient is sick, the patient may be having intense sweating, fall in blood pressure, breathlessness, etc. To confirm these, we need, if some such features are there, to confirm this, the patient requires to go to the doctor, get an ECG, get relevant blood test done, full evaluation. So any chest pain which is accompanied by breathlessness, sweating, prolonged pain, that needs detailed evaluation. Other causes are less common, the non-cardiac pains. Non-cardiac pains may be arising from the lungs, so there may be inflammation, or there may be chest infection like pneumonia, or there may be blockage of the artery which is called pulmonary embolism. Then the most common causes apart from chest pain of cardiac origin are the musculoskeletal pains, which we call the muscular pain. So they are typically very localized, and the person, if you press upon that area, the person has pain on pressure, usually self-limiting. Many times they are precipitated by anxiety, and these subside by taking some mild painkillers. The third is gastroesophageal reflux, that is, in common parlance it is called acidity. So the pain, starts in the epigastrium or the upper part of the abdomen and may go behind the sternum, mimics chest pain because of cardiac origin very closely. So we have to, if we think that the population is such, the person is such, he may be at high risk for heart event, like an elderly person or who has other risk factors of heart disease like blood pressure, diabetes. So in such patients it is important to rule out cardiac pain, and if everything is normal, then one can think of a pain because of acidity or gastroesophageal reflux. So in other words, it is important to identify the features of pain which is more serious, and not to get panicky about it. Seek a medical opinion. If there is a dire emergency, call for an ambulance and go ahead. Lifestyle care is important in the sense one should take care of the diet, regular physical activity, control of cholesterol, control of blood pressure, control of sugars, etc. And above all, not to miss staying away from unnecessary mental stresses. If you have any query, I would request you to log into my profile at lybrate.com and you can seek my opinion there, or you can seek consultation there. Thank you.